I hope you and your loved ones are healthy. I am Dr. Ron Sheftor. I'm going to be reading a script I have here because I wasn't able to get to my teleprompter, but I've talked to so many of our colleagues over the last 3 weeks that are so upset of what's going on that I feel I need to do this video. Good news is that we have dedicated scientists in the U.S. And I believe they'll create a vaccine for the coronavirus. I think all of you hope the same. But I also hope that they do it before the flu season so we don't have a second round of this. Dental experts are saying for the next 12 months, more dentists that own a high overhead office are going to go out of business or have a much lower income in 2020 and 2021 than in any of their previous years. They're saying this because the current uncertainty of when we can go back to work and the fact that all dentists are now using their reserves, if they had any, to pay the fixed cost at the dental office and in some cases, staff salaries. Cash reserves are also being used for personal expenses. Other dentists are having to use credit to pay bills, which is money basically they don't have. And it'll reduce their future income even further when they go back to work. The SBA disaster loan is a help, but it will not come close to paying all the business bills and the personal expenses. The low interest government loan is also great, but you'll still have to pay it back, and it will further reduce your future earnings. Also, historically, after and during a major event like this, people are slow to get dentistry done, including regular cleanings, because it does not impact their immediate survival like food and shelter. Plus, people tend to be afraid that they might get infected in a high-risk environment like a dental office. But the bad news doesn't stop there. A portion of our patients with outstanding treatment plans or on prepaid payment plans will not proceed with treatment or even ask for a refund on the work they paid for but have not yet completed. I had one patient today contest a $10,000 care credit balance, and the work was done 6 months ago. She was a great patient, and 6 months ago was very appreciative for the work that we did. But during hard times like this, she basically lied to Care Credit about why she's contesting the charges. Thank goodness we have really good documentation. Even some staff members told me that they're considering working in a less contagious environment, so we don't even know what staff we're going to have left in the next few months. Good news is there are some dentists that will get through the crisis just fine. Obviously, they are very concerned, but do not have extreme anxiety about having to close the doors or struggle for the next couple of years after a major crisis like this. I want you to be one of those dentists that will get through any crisis without extreme anxiety or go out of business when, not if, the next crisis happens. I know how to create a $1 million office with a 50% or less overhead. This business model has made me weather every crisis I've experienced in the past 37 years owning my own private dental practices. Even during the last recession in 2008, our collections were down 20% for 2 years, but our overhead still stayed around 50%. We did this with no associates, no large staff, and no evening hours. We did above average dentistry on people that were not real wealthy. I did not even do some of the high profit treatments like root canals, wire braces, or the placing of implants. My point is, even during a crisis, we can weather the storm with a profitable business model and enough reserves set aside. But think about it, even during the worst of times, the entire profession will never go out of business. In fact, there will always be a small number of dental offices that will continue to have a good financial year during any economic crisis. I'd like to show you how to be one of them. How, you say? By incorporating systems that keep the overhead low, continue to do quality dentistry, and do effective marketing that works in today's environment. Our offices will not be closed forever. While you are now closed and will have a light schedule when you do open up, This is the perfect time to put in systems to make sure you never have extreme anxiety again during the next crisis, and basically just to help you get through anything. I will coach 6 dentists in 2020. Please click the link below for your free 20-minute, no obligation consultation with me. See how maybe I can help you. I look forward to speaking with you.